When skin is broken, microscopic debris and opportunistic bacteria immediately begin multiplying on the exposed tissue. If left exposed or improperly covered, the risk of infection rises with every passing minute. To address this, Promed Gauze Swab Sponges, manufactured by Cotton Craft Private Limited, function as the primary physical barrier and high absorbency layer needed to keep the wound site clean. By following a precise, methodical application protocol, you can replicate clinical standards and achieve a clean, protected, hospital-grade dressing at home. This checklist shows the supplies required before you begin the procedure. You will need your Promed gauze, clean medical gloves, sterile saline solution, medical tape, and any prescribed ointment. Starting with USP-IV grade materials establishes the technical baseline for professional wound care, ensuring the recovery process begins with supplies that meet international pharmacopoeia standards. Step 1 is selection. Every wound requires a specific volume capacity for fluid absorption, which is dictated by the physical size of the pad and its ply count. This matrix charts options. The bottom axis lists sizes: 5 by 5, 7.5 by 7.5, and 10 by 10. Vertically, thickness is 8, 12, or 16 ply. For medium abrasions, we use the 7.5 centimeter 12-ply swab. This configuration provides the specific fabric weight required for moderate fluid management. When opening the packaging, extract the gauze carefully. Pinch only the extreme outer edges of the pad. Touching the center of the pad can transfer oils or bacteria from your gloves directly to the primary contact zone that will rest against the open tissue. These swabs are engineered with internally folded edges. This cross-section shows the raw edges of the cotton mesh folding inward upon themselves, which traps loose threads inside the core and prevents lint from shedding into the wound. The combination of edge-only handling and the internally folded design creates a protocol that minimizes the introduction of physical contaminants to the wound bed. Now we move to the physical cleaning phase. Apply your sterile saline directly to the first gauze pad until it is thoroughly saturated. Gently wipe the injury. Because the swab is crafted from 100% pure bleached cotton, its fibers create a rapid wicking action, pulling exudate and debris away from the wound site and into the gauze. Once the area is clean, discard that initial pad. Use a fresh, dry Promed swab to dab your topical ointment onto the tissue. This material is safe for direct contact with open tissue because it is chemically neutral. The USP-IV standard ensures the cotton is free from optical brighteners or harsh chemicals that could irritate sensitive skin. With the medication applied, place one final dry Promed swab flush against the skin to serve as your primary dressing. Secure the edges of the swab firmly with medical tape to ensure the pad remains in place during normal movement. Because of its chemical purity and structural integrity, the gauze facilitates a stable microenvironment for cellular repair. With the dressing secured, focus on the remaining materials to ensure they remain viable for future use. Leaving the packaging unsealed allows the gauze to absorb ambient moisture or dust from the air, compromising its cleanliness. To maintain the product, tightly fold the top of the Promed packaging over itself and secure it, or transfer the remaining swabs into a secondary airtight bag. Store the sealed package in a dry, cool location. This level of environmental control is what maintains the USP-IV integrity of the cotton until the next dressing change. This side-by-side comparison shows the results of the protocol. On the left, an exposed injury. On the right, a neatly secured professional dressing. Following these steps ensures high-capacity absorbency, protection against lint contamination, and hypoallergenic safety for the wound. This level of reliability is built into the manufacturing standards maintained by Cotton Craft Private Limited. For ongoing maintenance, perform this dressing change daily or follow the specific instructions provided by your physician. Utilizing professional-grade, standard-compliant supplies bridges the gap between clinical settings and effective home care.